Month of May has been dedicated to has been nominated as a Huntington's disease month, and Light It Up for HD was a program that Canada has come up with, and as a result of that, many buildings all over the world have been lit up to provide support for the HD families. So it is blue and purple are the two colors that have been chosen, and there was a very good response in India. The whole idea is that if more people are aware of this disorder, there will be more support for families, and doctors and professionals will be more aware, and hopefully life will be easier for HD families and patients in terms of treatments or other kinds of assistance that these patients often need in the course of their disorder.
The problem is not like a social stigma. What Madam mentioned is that's also a problem, because people will not believe that. Okay, even if and right people also, they are losing the jobs. They are working. Some people, software company, they are all working, so they've been removed it from the company, and their families have been getting separated. So many issues are there. The HD concern. I think some other countries they have done some better job. We need to learn some of the things, and whether we can able to adapt, and we can able to try to help them.
Because it's a rare disorder and because you spend so much time, I can almost remember 200 of the cases in my mind. What are the kinds of family issues they came with? What are the symptoms that happened? What happened to them eventually? What are the problems they faced? From all the hundreds of thousands of cases one sees at NIMHANS, I mean, you can imagine NIMHANS registration was, I think, 50,000 when I joined. It is now running at 9 lakh.
And I think we have to really work hard in that aspect, that to improve the acceptance of these patients and the caregivers, and to give them support in the society. Even in the clinical side and the hospital side, it is very much essential. But also, as Professor Sanjay Jain sir told, that it is 99% the family and it is the society the patient lives. Only 1% of their life they may live in the hospital.
Ours is a society where still, the HD person lives in the family. So they are in the family. So there's a lot more advice that is given to the family members in terms of how to manage when the person has dysarthria. So how much they need to listen more. They may request for a repetition, so the patient needs to repeat. So a balance between this is what that keeps the communication going.
Generally, Huntington patients will have the problem in exercise capacity or the endurance level. So in order to improve even at the pre-manifested stage, we have to encourage to improve the exercise capacity.